In this graph, we want to look at heart rate control, and we want to look at how that's done through adjustments to the nodal cell action potentials at the SA node. And recall that heart rate is one of the components that helps us control cardiac output, right? Heart rate times stroke volume, the amount of blood ejected per cycle, will equal cardiac output. And cardiac output, of course, is that flow through the systemic or pulmonary circuits per unit time. Now, one example of when cardiac output would need to be altered would be during exercise. And so we're going to get alterations in the output of our sympathetic and parasympathetic nervous systems to adjust both heart rate and stroke volume, allowing us to match our blood flow to metabolic need. Now, if we come down into our graph, our nodal action potentials are in red here. And what we're going to do is adjust the duration of these action potentials to adjust our heart rate, right? The shorter these action potentials are, the closer together they can be in time, and the faster the heart rate will be. And of course, vice versa. The longer they are, the farther apart in time they will be. Now, our action potential has several phases. If you recall, we have a pre-potential phase dominated by funny current. That's largely sodium influx. That gets us to threshold right here of our voltage-gated calcium channels. That gives us our depolarization limb. Then we would open voltage-gated potassium channels that give us our repolarization limb. Once again, that repolarization opens the funny channels again, so we start our next phase one after another. Now, during increase in sympathetic output, as occurs during exercise, we're going to get an increase in funny current. If you recall, funny channels are also known as HCN channels. They're hyperpolarization activated, right? Remember, that's our repolarization here, tending to cause them to open. But they're also cyclic nucleotide gated. Well, cyclic AMP is a cyclic nucleotide that is adjusted by the balance between sympathetic and parasympathetic output. Sympathetic output tends to increase cyclic AMP, which opens funny channels. We also get an increase in calcium influx as well. More sodium influx, more calcium influx makes our pre-potential steeper, and we get to threshold sooner, and our action potentials are closer together in time. That equals a faster heart rate. When the parasympathetic system is dominant, as during rest, we would get a decrease in cyclic AMP. That, of course, would reduce our funny current, our sodium influx. We would also get a reduction in calcium influx. That's going to slow our rate of depolarization during the pre-potential. Now it's going to take longer to reach threshold way over here, and our action potentials will be farther apart in time, a slower heart rate. The parasympathetic system also adjusts the flux of potassium. That gives us our second mechanism in B here of adjusting heart rate. In this case, we're going to get repolarization to a greater degree. That's a hyperpolarization. What that means is that now we have to depolarize further to a greater extent during our pre-potential to get us back to threshold. That's going to take longer, once again, generating a slower heart rate. And finally, the least common mechanism of adjusting heart rate is shown in C here, and that's when the threshold is actually adjusted. The threshold of those voltage-gated calcium channels. And that can occur through a variety of agents, but what occurs, the outcome here, of course, is once again, it takes us longer to depolarize through that pre-potential phase to reach threshold, once again, in separating our action potentials and slowing our heart rate.